Hello, and welcome to my Borderpolar podcast. This is my series one called A Borderpolar Diagnosis, and this is episode three. Episode three is called Some Limitations to People Understanding a Mental Health Diagnosis include the fact that sympathy does not equal empathy. We have to remember that sympathy is relating to someone basically hypothetically. So I can imagine what you're going through, not having been through it myself, and I can feel what feelings you might feel in your situation, even though I've never been in that situation. That's sort of sympathy. And then empathy goes deeper than that, where you can feel the feelings that they're having because you've been in that situation yourself. And sympathy doesn't equal empathy. And so if you're not talking to someone who has a mental health diagnosis, when you're disclosing your mental health diagnosis, you aren't going to be able to get real true empathy from that person because they don't go through the same things you go through. They might be able to empathize with you on what it feels like to be anxious. They might be able to empathize with you on what it feels like to have a depressive episode. They might be able to empathize with you on a lot of different of the secondary symptoms that I included in my episode of understanding border polar, those secondary symptoms, but they won't really get a chance to empathize with you and actually put their feet in your shoes because that's just impossible. And on a second note, knowledge does not equal understanding. And so you can explain the symptoms of a disorder to someone. You can explain how a mental health diagnosis works. You can explain a lot of things to a person, but that doesn't mean that they're going to fully understand. So just imparting the knowledge doesn't necessarily equal understanding. You also have to be patient during this whole process because if you're talking to someone without a mental health diagnosis and who hasn't dealt with anybody with one, they might have no point of reference for what you're explaining and how your brain works differently. They might have previously held beliefs about psychology in general, mental health diagnoses in general, and things like that. And if they have previously held beliefs that lend them to think that the science isn't science, or that mental health disorders can be just fixed by changing your thinking or getting over it, then it might be difficult to really get them to understand where you're coming from. So depending on what their previously held beliefs are, you might run into a roadblock there. There's also the complexity and the indescribable nature of mental health disorders. Trying to explain borderline personality disorder to someone in a nutshell is not an easy thing to do. Trying to explain bipolar disorder to someone in a nutshell is not an easy thing to do. I would imagine the same as with schizophrenia or schizoaffective disorder, the same as with PTSD, the same as with autism. Any kind of um, difference in how the brain works is not easy to explain to someone who doesn't have a difference in how their brain works. So it becomes very complex and very indescribable. So these previously held beliefs, the point of reference that they don't have, the difference between understanding and knowledge, and sympathy and empathy, all of these things are sort of limitations to understanding. So have some patience with the person that you're talking to. Take things slow and try to get your point. Make sure that they're understanding as you move on.